Okay, it's 8 p.m. Pacific time. So let's get started because we have a lot to cover tonight. I'm Mark Sin. Welcome to the Singapore Connect Forum. This is the 29th forum, and we've been doing this since the pandemic started, 15th of March 2020. And well, today is the day before Halloween, so I don't know what plans everyone has for tomorrow. But we even had one last year, very cool on Halloween, and I do remember that actually Jazz was dressed really, really nicely in a Pirates of the Caribbean costume. So Jazz, right there in the other window, is my co-host for tonight. Let's go to the next slide. Let's talk a little about Singapore Connect. I just want to get this out. Singapore Connect SGC is a volunteer org. Singapore Global Network SGN is by the Singapore government. So we are all private individuals in Singapore Connect, and we're non-paid. All right, we are a social club for food, fun, and friends. You can see our social media webpage links below. So please join us, wherever you are, even if you're in Singapore, and because this pandemic has led us to do many events online. And I'm just gonna pull up this slide from one of the prior forums about anything funny or goofy that you will look back and laugh at that happened due to the pandemic. Everything happening on Zoom, yes, delivering a newborn without support. But look at the last one. Kids exchanged a single roll of toilet paper for graphics card. So I hope that lightens up the mood. That serious topic, but we had a lot of fun over the last year, even despite all the craziness of the pandemic. And so, I'd like to segue to this event that's actually happening next Saturday, coming up just in a week. We are going to celebrate Deepavali for the very first time by Singapore Connect. It actually builds off our celebration of Adifitri, Hari Raya, and which was also the very first time that we did this year. So Deepavali is next Saturday, 6:30 to 8 p.m. It's going to be online and in person, and the website, we'll get to that. We're also having a dance challenge. If Srita is on, Srita is our chairperson for the event. But if she's not on, let me introduce a bit. So dance challenge, you get to put a 30 to 60-second video on Instagram, TikTok, your social media preference, as long as you tag this particular hashtag. We will find it, and you have to be present to win, but we have some awesome prizes. We'll get to who's sponsoring, and it's probably over $200 just for the first prize. So hope to catch your best moves at our dance competition or challenge at the event. And I'm just gonna give it a shot. Let's play this little video and see if it actually works. So it should be Deepavali themed. You can find the music, and you can do it as a family, obviously, not just one person or solo, and it should be family, family friendly, right? Keep the lyrics in mind and such. Thanks for participating, and moving on. I also want to add, of course, who would not have an event without food, and we're so pleased to be debuting in the San Francisco Bay Area the first official meals from the Curry Leaves Bistro, which is actually operated or owned by Jai, who actually has been very well known for delivering char kway teow to our community in the San Francisco Bay Area. So he just cooked this meals fresh today, and we're so happy to feature his food as well as many other options from Los Angeles and Seattle at the event. So, please mute, and let me just give a sec.
We can hear you.
Let me try and see if I can help mute this person first. Jazz, are you able to mute?
Can you say a sentence?
I'm gonna make you a co-host, Jazz.
Yep.
Okay. And if you can help mute someone on the background. I think it's this person. Let me go. Okay, you figured it out. Yeah. All right. Deepavali registration is now open. Food sales are open, and this is the link. You can. Oh, and this whole slide set. I'm gonna copy and paste this link right now into the chat session. It will also be on our forum page, the one that you're going to by the end of this event. So you can actually click through all the links, especially very helpful as we go on. All right, let's first let me acknowledge. So SGC is not SGN, but we do want to thank you, SGN. As you can read this blurb, they are supporting the SingaporeConnect Deepavali celebration. So thank you, SGN. And David Ho might be online. We can say a few words shortly. All right, let's get to the real meat of tonight. It's the VTL agenda, a VTL topic for tonight. And with us today, I don't know, Jazz, would you like to introduce some of our other participants on the panel?
Absolutely. Well, thank you all for joining us this evening. Just a moment, though. Srita has just joined us. And I wonder, Srita, if you want to just give a couple of words, share with us a couple of words on Deepavali.
Hey
Please.
guys. Hey, I think Mark covered it, but I really want to wish everyone a happy Deepavali coming up soon. And we're going to celebrate this thanks to SGN, thanks to Wilson Koo. Everyone should register. There is a dance challenge going on, guys. We've had a ramp up of submissions recently, and I want everyone to just, with their kids or alone, with grandpas, grandmas, everybody just participate. We have a lot of prizes to give out and we're going to vote on the best answers. Just have fun. It's the festive season. So I hope to see everyone participating on the dance challenge. And this is even if you don't buy tickets to, get food, you can still participate. So yeah, hope to see everyone at Deepavali.
Thank you so much, Srita. Sounds like a lot of fun indeed. Okay, so let's get started. Well, I know Mark's working through this to try to get that link across to everyone.
All right.
But with us this evening, we have with us Singapore Consul General William Chick from the San Francisco Mission, as well as Hui Wang, who's Consul of the Singapore San Francisco Mission. Other government officials include David Ho, who's from the Singapore Global Network, a very, I think, friend to many, many of us here, as we've seen him a lot in WhatsApp groups as well. Of course, Mark Sin, who's the president of SingaporeConnect, and I'm Jasmine Young, co-founder of SingaporeConnect. This evening, we have some special guest speakers too. We have an SIA representative, so we bring, current sort of travel-related industry specialty and information. And then we've got a few folks who have just experienced the whole VTL journey back to Singapore. So you get right from, fresh from, some of the horses' mouths, right? In terms of their experience right through the pioneers of this whole experience. So you can have some Q&A for them as well. So very exciting session today, I think, because this is a topic that I think everyone's been interested in online in the WhatsApp group. So we finally get to hear from some of our different government officials as well as travel industry experts.
Thank you, Jazz. At this time, I don't know if anyone would, CG William or Hui or David, would you like to say anything? If not, we can continue. Hi, CG William.
Hi, happy Saturday, happy Halloween in advance, everyone. Thanks to the SG Connect team, Mark and Jasmine, for doing this. I think it's a very timely and relevant discussion that we're having today, given the anticipated, I think, increase in flights to and from Singapore in the coming weeks as we enter the holiday season. So I just wanted to briefly mention a general point before we go into all the dive into all the details. It's just to remind everybody to bear in mind that what we are discussing here may only be a snapshot, because the situation, as we all know, is very fluid as Singapore is continuing to open up its economy and its borders. So given this fluid situation with the number of infection cases, it's very likely that we will see some adjustments to the border measures. So the general rule of thumb is, please everybody to bear in mind that you should keep yourself updated through the various links and websites, government websites especially, on the latest travel measures, including VTL, as we head into the holiday season. So just a brief mention about this uh, general point before Mark and Jasmine go into the details. So hope we have a good discussion tonight. Thanks.
Thank you, CG. That's really good advice. Everything is really fluid, as you mentioned, and we should be looking at the different links offered, right, just to keep up to date and to check, depending on when we're traveling. Great advice. Thank you so much, CG, William. All right. Mark, shall we push on?
Hi. So let me quickly go through the pre-forum survey. Some of the questions were mixed with the vaccine questions. We're not going to go through those now because we're going to do the vaccine talk separately. But I'll just pull this one answer from the vaccine section of the survey, and it's how you fully vaccinated. It's really encouraging. Look, it's almost 97%. Next. This is a little bit of boo-boo on me. Apparently I didn't put 0 as an option. I kind of thought everyone did it as HN. So assuming that no response meant 0, it probably means about half of the people haven't done an SHN, but actually probably 40% have done. And even 5.9% 2 and 1.6% 3. And one of those was me. So but fortunately, maybe we'll never have to do another SHN given the VTLs. So moving on, have you booked a VTL flight? Well, most people are no, but a stunning number of folks, almost 40%, yes. So I guess lots of us are going to be very interested to learn from those who are going or are going to go very soon. This was interesting because we kind of did this question for much of the pandemic period. Well, are you planning to return to Singapore because of COVID-19? Now, of course, the perception of this changes, so it's interesting to look at over time. But I think the dominant, as you can see, is I plan to stay in the US, but I have not traveled to Singapore since COVID started. So this is that really, very keen to get back. But there are also folks, the next biggest group, 30%, they are planning to stay in the US, but they have actually traveled back and forth already.
The hallway light.
Since COVID started. Okay, moving on. This one was something that we kept asking many times over the line. You can look at past surveys. How many more weeks do you think COVID will be over and life is back? And then we realized that life is going to be no longer back to what it used to be. It's going to become a new normal. So it was interesting. For the first time, I actually put 0. Do you think we're already in a new normal? And actually more than 58% just said that we're in a new normal. You can see the range of responses for the rest. There's a little bump at 52 weeks, 1 year. But almost everybody, majority, thinks that we're in a new normal, which is a very interesting thing for all of us to contemplate. All right, Jazz, would you like to talk about this one?
Absolutely. So since last year, we've been tracking the perspective of the confidence level, right, of whether the Singaporeans in the Bay Area and the US feel if US is going to be overwhelmed by the healthcare system or Singapore. What's interesting about this trend is we generally saw that for a large part, most people was confident about Singapore's response, to the COVID situation. So it was generally the red line and was lower, where 1 is not concerned and 5 is very concerned it will be overwhelmed. So generally it was always the US. But today, in this week's findings, it's actually the other way around. For the first time ever, we have people more confident about US's response versus Singapore.
Yeah.
Great. And the next one here, in terms of the pace of opening, right? This is also interesting. We've been monitoring this since last year. Of course, we have a slightly different scale now. We have over 200 responses versus last year's 23. But from the last point, you'll see now as well that essentially folks are thinking that the rate of opening in Singapore is about just right, whereas California is still a little too fast. So it was very fast last year. I think there was a lot of uncertainty. You can see that
winter surge, I think, caused this, right?
Yep. So there was a bit of concern, like in December. But a year later, or at least 10 months later, we're sensing that folks are feeling it's about time. So 3 is about time, where it's not too fast, not too slow. It's about the right pace of opening.
Cool. All right. Thanks, Jazz. And let's jump into the VTL intro. Now, before we get into the intro, while we get into intro, I just kind of want to take you guys a little back to April. See, Straits Times, vaccinated Singaporean residents traveling countries of low COVID case could be exempt from quarantine upon return. So, it's always been talked about. If you're vaccinated, you can travel without this quarantine or SHN. And then they opened it up in Germany, starting with Germany and Brunei. But the folks were subject to several COVID tests when they returned and a short period of self-isolation. So it started in August with 2 countries, and as you all know, it has now reached out to 11 total countries or regions. So the US got into it starting October 19, and the first flight departed from New York. And well, as most of us are expecting, the VTL would allow you to see your families, and also for folks doing business to get to Singapore and back to US doing business for all the time-consuming quarantines. Now, before we get onto that full VTL topic, just want to mention that there are still alternatives to the VTL if you're not vaccinated. USA is also now in Category 2, which means you have these options. You still have to do an SHN, but 7 days, and you can do it at home or your choice of hotel. And you can still bring a paper record of your vaccination to get recognized as fully vaccinated for 30 days, and then you do storage tests. We'll get to that later, to enter restaurants and malls, etc. So just bear in mind that this is an option. But I know most of you want to go straight into VTLs, and want to mention that just about all the things that you've seen in the subsequent slides were taken out of information from these websites. So you should use these as a resource, and as CG William Chick mentioned, please keep checking with them because things can change. Make sure you have the official source. We are in SingaporeConnect. We are just compiling the information from the sources referenced to the best of our knowledge. We do not take any liability for the use of information we've compiled. Please, again, consult official sources when you actually need to be very sure of something. Having said that, let's go on to what. So I could go through this checklist, which I think it's the best starting point. But actually, haven't some people talked about it, like maybe what if we kind of did it in a different way? And let's go through this presentation. So first, PreReq, you need to get approved. You need to get vaccinated, obviously. And Singapore actually has approved a long list of vaccines. I don't think we have an issue with that in the US. Next is you need to show proof of it. Now we get into that later. You need a digital vaccine record. You can either show an app or you can show a certificate that has a QR code that can be scanned. So we'll get to both of these. And you can also read all the details over here. All right, let's go through this flow chart because some folks actually asked in our Q&A, can we see the procedures? And we've got all the links, but let's just kind of think, so you can have put all this on one page on the slide. The real thing is just if you are under 12, you don't need to get vaccinated because they're not approved for children yet. But if you're over 12, you need to get vaccinated and get what's called a smart health card. This is again context flying from USA. And you get the smart health card, go ahead, book your VTL flight, and so on. Now, if you're a Singapore citizen, you can just go, but if you're a non-Singapore citizen or PR, you need to get what's called a VTP, like a vaccinated traveler pass. And in addition to that VTP, if you are a short-term visitor, you need to ensure that you have COVID-19 insurance, and you can buy some, and we have some details about that you can get to later. Now, for children that are accompanying the passengers on this route, they do need insurance if they're non-Singapore citizens or PRs, but if they are fine, then they just accompany without having any proof of vaccination because they're under 12. And then, you book VTL flights. I think most of you know that there are certain flights that are VTL flights. They're operated by Singapore Airlines from the US to Singapore at the moment. And they do have some kind of a VTL logo or tag on them. Next, you want to have a accommodation in Singapore that you can stay at for this self-isolation. And we'll get to that in a timeline, how long that might be. So you need to basically get a home or something. We also have a chapter on what that is. You need to fill out the Singapore arrival card. It's a pretty simple card. Basically, you have to list your travel history, but you do have to fill this very correctly because, there are penalties if you make any, false information on it. All right, let's talk about pre-departure PCR testing. So it's not necessary for those 2 or under, but for those above 2, you do need to get a test. We'll talk about the timeline. And if it's a negative, you take your flight, go through immigration, and then you get an on-arrival PCR test. And then you self-isolate at that secure accommodation that you told the immigration authorities and the arrival card that you would be isolating in. And once you get this OA on-arrival test result, we can talk about how you get it. If it's negative, you're free to get out and do what you need to do in Singapore. Some caveats about trace together and a serology test. Now, what happens if you were positive in any of these tests? If you're positive at the pre-departure test, I'm afraid you can't fly. If you were positive at the on-arrival test, you're going to have a mandatory stay in a hospital or CCF, and we have a FAQ page you can see. And hopefully you had insurance, because you'll be responsible for medical and those charges for staying in that community care facility. So, any quick questions or any comments from the folks? Not, I'll move on to the timeline. So again, all this information is from the travel checklist. So key thing is, let's start away from the left. You do need to complete your vaccination and be considered fully vaccinated, and you need to be basically 14 days after your last jab is when you'll be considered fully vaccinated. So I think most of us will be already way done on this point, but just to note that. The other long pole is, if you have to apply for that VTP, you need to do it 60 days to 7 days before the flight over here. So that's only for non-Singaporeans and PRs. All right, so there are quite a few caveats that they do note. So for that 14-day window before the flight, you have to be inside the VTL country region, meaning you can be within any of the 11 countries that are part of the VTL. How you travel between the countries, whether by train, road, or another non-VTL flight, it's I believe it's not an issue, and if anyone can clarify, that would be good. But your travel history should, including transit, so only within this region. So don't think about transiting through, say, a non-VTL country en route to Singapore. Anyway, that won't be a VTL flight. So you do need to obviously have that vaccination cert, which we'll talk a lot about, because that's a major issue. And obviously, just besides having your COVID test negative, you also can't have a COVID diagnosis, or you have been, at least you've recovered since 14 days prior, and then they actually wrote 10 days prior, you cannot be a close contact of a COVID-19 positive patient. So I believe you have to answer these questions on the arrival card, so you need to be truthful about that. All right, at 3 days prior, you can fill the arrival card, and we have a little tip about that, but we'll get to that. It's 3 days, and 2 days prior, you do need to start your PCR swab and have it 2 days prior to the departure date of the flight. We'll get to that. You also want to, as a very good advice, just prepay for this on-arrival test, because otherwise you have to pay for it at the airport, and it's just going to be a little bit more hassle, and you really just want to go through everything as smoothly as you can. So you just prepay for this. That's some kind of a link from a Changi website. So you kind of take this flight, it's about almost a day, right, 20 hours or so, and you arrive immigration quickly, and you pick up your bags, and you go for the on-arrival PCR test. You leave the airport, and by that time you should activate Trace Together. We'll talk about that. Now, as soon as you leave the airport, you must immediately go to your self-isolation accommodation. Obviously, don't take any detours or get food or anything. You also can't take public transport. We have a section on that. Now, sometime within this self-isolation period, and it could be maybe as fast as 2 hours, could be as long as 24 hours, so maybe 8 hours, you hopefully will get that negative on-arrival PCR test result. And that's your one signal that you can go free. Now, once you go free, do note that when you enter immigration, they're going to give you, based on your overseas vaccination, a fully vaccinated status on the Trace Together app. And this is very crucial, because you need it to prove you're fully vaccinated in order to enter a lot of things in Singapore, such as shopping malls and restaurants. So, but note it only lasts for 30 days. If you want to make it last longer than 30 days, you need to take this serology test, and you probably want to start it early on, because it could take a little time for the test to be done and the results to be updated and traced together, so that, and that's only matters if you're actually going to stay past 30 days in Singapore. Any questions? Kind of really ran through, but this is really
Mark, we actually do have a few questions that have come through as well. So let me just go through. Lydia has one. Just going through the order. If a PR person tests positive on arrival as Singapore, and needs to go to a hospital, do we need to have bought that COVID-19 insurance pre-flight?
Do we have anyone who can help answer that, even by chat?
I'm Hui Hui from Singapore Consulate General in San Francisco. So
Thank you, Hui
for
Hui.
Singapore citizens and PRs, they can use the government subsidy MediSave and the MediShield Life plans to help pay for their bills. So it's only short-term visitors that must get the COVID-19 insurance prior to the travel. But SC and Singapore citizens and PRs can use their existing government subsidy and MediSave. But Singapore citizens and permanent residents are responsible for all charges of the bills. If they test positive upon arrival.
Thank you, Hui Hui. I have another question that maybe is a follow-on or related. Just to confirm, here someone's asking if my spouse is a non-Singaporean and is only transiting through Singapore, does he need to purchase insurance and also apply for VTP?
For transit, they have to check whether it's a transit route or not. VTP is mainly for entering Singapore. So transit is actually a separate matter altogether. They can check with us or check with ICA separately on this issue. I will not cover this because it's not part of VTP.
Got it. Thank you. Another question, can you confirm completion of Singapore arrival card? Tariq says he was under the impression that it needed to be done 3 days before arrival in Singapore, but this chart seems to suggest 3 days.
Have a good point,
Right.
Tariq. It probably is 3 days before arrival, and we have a question later on about that, so I probably should edit this and move this back, but yes, you're right. Just do it before your flight.
Perfect. And then Kristen is asking, do we need a Singapore mobile number for the Trace Together app?
So we have quite a few folks who have gone on a VTL. I wonder if they can tell us that. I believe the answer is no, and I have an FAQ on that as well.
Hi, Dale here. I'm already in Singapore. From my own experience, I was using my US line when I first arrived. I continue using my US line for that, as long as roaming is in effect and
I
you
think the
have got
key is
good
you
connection.
need to be able to receive an SMS, like the two-factor
That's right.
authentication type thing, as soon as you registered. So if you have roaming, it's fine.
Great.
Yep.
Perfect. Thank you.
We have another question from Cheryl.
If you test positive OA in Singapore, how long must you stay in hospital? Yeah.
There is an FAQ question, or I listed one of the Q&As on that. You can click through to that link. Maybe we'll just get to that. Should we move on?
I have one more question, and we can decide if we're going to take this now or later. But does the fully vaccinated status in Trace Together last for 30 days from each entry into Singapore, or only from the first entry into Singapore?
Do you know, Hui Hui?
It depends. I'm not sure whether this person is asking from the perspective of someone who has completed the serology, or it's just entering Singapore for US and has not done the serology. So meaning to say, if you're under this VTP, Trace Together will only be updated for 30 days. But if it's actually after you have done your serology and all that, the Trace Together, your Health Hub app will be actually updated. And that is something that you would have to do at your own cost. So
I think
once you have done the serology test, that will be actually considered into final.
Got it. This
have the
person is
impression
clarifying
that
to
it's
say
30
that.
days per visit. So if you were
Yeah,
to only
correct.
visit less than 30 days each time, you don't really need a serology test.
Yeah, correct.
Until the
So
policy
meaning to
changes.
say, if it's VTP, and you enter at Changi Airport, they will just update for 30 days per visit. But if you want it long term, then you should consider doing it for the serology test at your own cost.
Okay, thank you. That was helpful clarification.
Should we move on?
Yes, we have a few more questions, but I think we can move on for now.
Okay, actually, we were just gonna go straight to this. Let's hear from those who just did it. And also, one of our participants was unable to join, but he has kindly provided this. It's a very detailed document. So, again, go and take a look at it. It covers so many things, including the VTP. But actually, let's hear from those, maybe Dale or Kevin. And anyone else, actually, you're free to just unmute and chime in.
Hi, this is Anne. I just arrived yesterday, and the thing about the Trace Together program is that they are having issues uploading our vaccination records onto Trace Together. So that's the reason why I haven't seen mine. So we've been like, this morning we've been stopped by people who say you are not, you cannot vaccinate. So just want to kind of let people know that this is a process in that's that's evolving. So this is said that they're just having so much issues. Uploading returning Singaporeans vaccinated records onto Trace Together is not on the priority list. So I just want to let everybody know that if they're Singaporeans, I don't know about if they're non-Singaporeans coming in, but we both haven't seen ours being uploaded in there. So so my question about serology tests. We just went to a GP, our regular GP here. We are charged $55 for to take a test.
Yeah. So on that point, Calvin here. So I arrived about a week earlier. My status update took about 6 hours. 2 hours in, I was getting a bit concerned because I was basically stuck there. I couldn't do anything. But the thing is that my PCR test at Changi and the vaccinated, fully vaccinated status were updated exactly about six hours later. And to the earlier point about the serology test, I was told by the clinic that it would take up to about 2 days to be fully updated. But in most cases, it would take about 12 hours. But it really depends on when you do it and when the lab test is out.
Hi, Dale here. Just wanted to add yet another data point. I got my vaccination status. I got lucky. My vaccination status was updated almost immediately. By the time I got to my self-isolation accommodation, it was already in, and then it took me about 4 hours to get my PCR test in. So I think just based on what I'm hearing so far, I got exceedingly lucky. Yeah.
Now I'm just now just really jealous.
I'm sorry.
Think about it. This is like the SHN lottery that we used to play. Like some people get the Ritz-Carlton and some get something else.
Well, I guess I have a question. Where are you all from? Meaning, where did you travel from? Was it California or some other part of the United States? Because I understand some of the vaccination records aren't necessarily all, uploaded in the same way.
I came in from San Francisco yesterday.
Yep, same here.
So all three of you had your vaccinations in San Francisco, and you have the California digital vaccination records.
Yeah. So for my case, when I went to the immigration, so for my case, when I go to the immigration, the officer just had a look at my my iPhone health app, and then he just took a note of the dates, and he keyed in something in the system. So from what I understand, it's rather manual. And what I could read online on a vaccination status update is that they actually do it in batches. So it really depends on when you arrive and yeah. So if you are right at the top of the batch, then good for you. If you're right at the bottom, and then you might have to wait for a bit.
Great, thanks for that perspective. So it's a manual process, so we have to cut them some slack, right? Anna, good luck there.
Just wanted to add just a little bit about the serology test. Mine took about 2 days as well to get, and I was struggling with it because I had intended to stay a little bit beyond 30 days. And I found that I could not understand the system by which by which we could actually get the serology test done. But after a while, I figured out that there is actually a MOH website. I cannot recall what it's called, but it's basically like looking for flu, like a flu clinic site. But basically, it will list all the clinics that have the capability to do the test and to update more importantly, to update to the Health Hub. So mine took 2 days, and it took me quite a bit of time to figure out that the clinic at my doorstep was indeed prepared to go and do the test.
Thanks, Dale. Anyone else? By the way, we have some folks who are replying in the chat, so I think one of the things should mention, if you have health insurance in the US, you should check with your insurance provider whether this covers overseas hospitalization and COVID-19 treatment. If the answer is yes, you do not need to buy a separate COVID-19 insurance to enter Singapore.
That's a really good tip. Thank you. We have another question from Roderick here. Does anyone have experience with getting a smart health card when their initial vaccination provider was not registered as an issuer with the smart health system?
We are skipping ahead to the smart health section. Should we just get there and then we'll cover this question?
Sure, let's do that.
Okay. So let's move quickly. Now, I actually want to mention this because not many people seem to have been noticing that the US is going to require proof of vaccination to get back in starting November 8th. And so you can go and check out the CDC websites. Most of you know that you do have to take a pre-departure COVID-19 test as well 3 days before the flight. And the US is pretty flexible. It's 3 calendar days. And it can be just about any viral test you can ever, think of. So many acronyms. In reality, you should just take the ART because it's cheaper and faster. And make sure it qualifies. But starting November 8th, you need to be vaccinated to get it 3 calendar days. Otherwise, if you're unvaccinated, it's 1 calendar date. And note, it's there's some rules about this vaccination. So it's 18 years or older. Vaccination is actually mandatory for incoming travelers to the US, except for US citizens, PRs, and some exceptions. So the US citizens, PRs can actually do this 1 calendar day thing and still get in, but non-immigrant visitors will need to be vaccinated from all countries going into the US. There's some exceptions. You can read them over here. And depending even on those exemptions, you actually may be required to self-quarantine or self-isolate. And so this is new policy that's starting pretty soon. So take note. You can't take any flight. There isn't such a thing as a VTL flight, to my knowledge, from Singapore to the US. So if you have to do a transit, it's cheaper, whatever, go ahead. So any questions?
Actually, before you move on from the VTL section, I just noticed June Tan had a question. Has anyone flown out on a non-VTL flight in transit through a VTL country and then take a VTL flight to Singapore from a transit country? Any problems upon arrival? And we have also another question from Sean asking if anyone from New York can share their experience too, if their experience is different from the 3 San Francisco folks, right, that we just spoke with. Can we take either of these questions, perhaps? So the first one, did anyone fly on a non-VTL flight and transit through a VTL country and then to take a VTL flight from there to Singapore from the transit country? Were there any problems with that upon arrival? That's the first question.
Is there an answer I can see from travelers might not have any travel history outside VTL? You can transit. But you can't go to you can't transit in a non-VTL country. That's the key point. Transits count as a country, even if it's a transit.
Actually, when I see the Singapore Airlines website, the flight from New York to Singapore via Frankfurt, actually there is a straight flight with a stopover at Frankfurt. But if you want a VTL category, you have to stop over for 12 hours to take the connecting flight to Singapore. That is the next flight, which is a VTL flight. So the last leg should be the VTL flight. And so if you book the direct flight from New York to Singapore via Frankfurt, there is a stopover of 12 hours, even though the original flight, which goes from New York to Singapore, is a direct flight with stopover. It is not a VTL flight. So I would presume that going by a non-VTL flight to a VTL country and taking the last leg of the journey from a VTL country to Singapore is what matters.
I believe that's what matters.
I'm seeing some commentary from CCS as well, and he confirms this is correct. Yes. Great.
You can go between the VTL countries in any form. non-VTL flight or land or sea or rail or something like that, transport, train between Europe, for example.
Got it. Great. So thank you for that. Anyone?
I did read somewhere that if you're taking a train which passes through a non-VTL, like in Europe, if it passes through a non-VTL state of Shenzhen, then technically you are transited through in the last 14 days and you will not become eligible to take the VTL flight. Even if you take a train which doesn't stop or it passes through that particular state which is non-VTL, then you become ineligible to take the VTL flight.
I guess you should take a flight, because when flags fly, they don't seem to count where the flag flies over.
That's right.
I see. Yes, your travel history is what you tell ICA. It looks like from what CCS is saying. Thank you, CC. Going back to this, there are folks from New York asking about folks flying in from New York or Houston. Any comments there? And Abhinaya, I think you have some experience as well. You just commented here that Houston flights are non-VTL.
Yeah, but you just have to fly to, I guess, New York or Los Angeles or San Francisco, and maybe Seattle to come.
Yeah, that question was from me. My name is Murli. I'm actually flying from Houston to San Francisco and San Francisco on to Singapore, and that's the reason why I asked the question. And I could only book 2 itineraries, one on United from Houston to San Francisco, and then on Singapore Airlines from San Francisco to Singapore. Because when I booked the tickets, couldn't book the direct or the on a single itinerary.
I think you're fine.
And I just had a follow-on question. My pre-departure test, the 48 hours starts with my flight from Houston to San Francisco, I believe.
Yes, we do have a exact question that will come up later on that, but yes.
Thank you so
flight
much.
Of your trip, assuming that they're all in one itinerary and their connections. If you do a stopover, I think you have a problem.
Well, it's not one itinerary. I had to book 2 separate tickets, but my layover is 4 hours, 4 or 5 hours at San Francisco Airport.
I think if you take a Star Alliance flight, you can through check-in using United check-in to SQ, which SQ allows. So with Star Alliance flight, then the baggage can be through check-in, which is a proof that you have transited through San Francisco and took the onward flight.
Okay, thank you for the clarification.
I'm not an official, but I have traveled it's not official information, but I have traveled like that before. If you take United, you will be able to through check-in.
Okay.
Okay. So maybe let's kind of move on because we got a lot of stuff and we got about maybe 40 minutes left. So this is a really hot topic, digital vaccine records. Let's just start with a nice preamble. Again, going back to April, Foreign Minister Vivian said, health certificates must be verifiable and interoperable. And it has to be trust. So kind of moving a little on, that Singapore is exploring mutual recognition of vaccine certificates which may be digital and have to be secure and verifiable. So that really gets us to today. Look at this list. This is the acceptable proof of vaccination. You can do the Trace Together app. So for those who are wondering how your fully vaccinated status looks once you get your either serology test or the thing show, it's like that. But I think most folks in the US are trying to make use of their vaccinated in US vaccination records, and this I think is the key part. You need to be part of this SHC Smart Health Cards by these 2 networks, and we'll get to that. And please note this screenshot is from this webpage. So just for those who want to know the details a little bit, this Smart Health Card is really like a format for health or vaccine records, and it just looks like a QR code. You scan it with a special QR code like scanner app, and that app can basically read the information and also verify that it is legit. And Singapore is saying that this SHC not just has to be a proper SHC, it actually has to be issued by a medical provider or a body that is part of these 2 networks at present. Now, new providers are being added, so we should keep checking. You can check the list over. Oh, this is like basic information, but some providers have been dropped, like maybe vaccine check. So that's an interesting topic which we may not cover, but just as a note. Now, just moving on to the basics. So you can get this app, and you can scan your own QR code that you can get from your provider, and you can verify it that your QR code, your digital vaccine code has 2 green ticks. That means you got a good code, it's valid. And this is basically what the airline is going to be checking. So that's how you can be sure that you can get through. Basically, this code contains your name and your date of birth, and your name should match, and of course your date of birth should match your other identity documents such as your passport. All right, so basically the steps: get this SHC from your medical provider. It's a lot, I know, step A is a lot harder than it looks. Check it with the app just to make sure, right, so that it's not at the airport for the first time you find out whether it works. And I think some have noted, if you're an iPhone user and you update to the latest iOS, you can add this QR code, SHC code, into the wallet and the health app for quick access. So SingaporeConnect, we just kind of put out a survey, and there's some results over here. It's about 10 or so. So we can go and take a look. There are some people who have stated how they were able to get SHC depending on which medical provider they got it from. But the easy stuff. So if your vaccination was done in one of these states, then it's easy. The state has already a statewide system, and all the providers basically have to work with the state. So some links for that. And the hard part. So this is the hard part. What happens when your medical provider is not on the list and you only have the CDC paper card? So, well, ICAs did kind of try and answer this in part, saying that we are working on accepting, digital from other issues. Further details will be shared. So, and they kind of want to emphasize that they need to verify the identity of the issue. That's why they can't take that paper card. They want to be able to trust the origination of that vaccination record through digitally verifiable means. So what else can you do? Some people have reported success signing up with another health provider that is on that verification list, then basically getting them to accept the vaccination from maybe a scan of the CDC card, and then go through. So there's some anecdotes listed over here about that. Another one that obviously would work, but that implies you're willing to do this. If you were to just go on a non-VTL flight and SHN and get serology tests, you're just going to get fully vaccinated. Then the next time you travel, you can take a VTL flight, because Trace Together obviously is an acceptable digital record for VTL purposes. So not the best answers to everything. I don't know if anyone can chime in with more, but let's go on. So one of the key questions folks ask was, what happens if your full name is not on that smart health card? Especially those people who have like a Chinese and English name, and then somehow the Chinese name maybe was put in the middle name, and then they were missing it, or it's truncated, and now it doesn't match the passport. So I think we can check. But if you had a VTP, one of the issues is that they kind of have to do this QR code submission as part of the whole process of getting the VTP, and this name checks are automated. So you may have to contact the Safe Travel Office, which is ICA, to explain. You can kind of see, if you went through their website, there is actually a clickable link to an inquiry form. Now, for Singaporeans and PRs, you actually don't need a VTP. You actually show up for the first time at the airport with that QR code. So what we understand is the staff are actually going to use human judgment when checking, and if your date of birth and enough of your name matches, then they are convinced that your identity and your vaccination record is a match. Clearly, it is best to make your full name match, and so just kind of make it obvious, right? The easier it is for the officials to check, the more likely you will have a smooth time. And that's some detail here as well. Yeah, so I'm not going to read through every question. We can kind of go through this if you want to browse. And so also note that you can get a digital vaccine record from Singapore for the US for that return path that we're talking about in November 8th. And you can probably also actually get a booster shot in Singapore if you want it, because Singapore is now giving them to those aged above 30. And you probably should be able to get US health providers to accept it. That's if you feel like you want to do it. So, and just reminding folks, the USA is requiring COVID-19 vaccination starting November 8th. They will accept a long list of things, though, probably a lot more flexible than Singapore, including paper records and non-verifiable digital records like a screenshot. But they will accept that CDC card, and they will accept the SHC. So if you want to feel good about it, you can technically use that to get back into the US. And this kind of stuff is basically the same as what Singapore needs. And this list is actually slightly different. It's a subset of what Singapore wants, but probably most people won't have an issue because you're not taking like Sputnik or some other more obscure vaccine. So maybe now we can ask any questions about vaccine records. I know it's a big topic. Jazz,
I've got a question. So,
go ahead.
So the WA verified for Washington State, the first day that they launched the site, the QR code only showed name and birthday, and did not show the dates of the vaccination. This has since been rectified, but for anyone who has the old QR code, would that still be acceptable, or do we need to get the updated QR code that shows the vaccination dates as well?
I feel the answer should be yes, because one of the things I saw in Singapore was they wanted to check that your vaccination is, like meets the 14-day before, so you're fully vaccinated, and the interval between the first and second dose is like 21 days for Pfizer, 28 days for Moderna, and so on. So I believe the answer is yes. You should get the one that has the vaccination history, the type of vaccination, the date, and such. So good question. Probably should be more emphasized, although I think all this information was in one of the ICA FAQs.
All right, well, we wait for more questions to come in. I see one from Sean Wong. If I have my spouse's vaccination records that's verifiable with SHC, can I get their records updated to their Trace Together app? He's going back, but she's not. Yeah, I'm trying to understand that question. Sean, can you give us a little bit more color?
But they won't be able to do a serology test, right? Because she's not present to do the test.
I don't think you can update someone's records without them being present.
Got it. Thank you. Hui Hui. So Bernard, go ahead.
Oh, sorry. Hi, my name is Erica. I have a quick question. So on the part about what if my full name is not on the SHC, I don't know if this was just how it was recorded in California or just how it was for me, but my middle name was dropped from the record here, but it is included in my passport. For something like that, has that been problematic for anybody returning, for citizen or not?
I think this is really this question and answer, right? If this key point is enough of the name.
Matches, okay. Okay, great, thank you.
And the date of birth, obviously.
Right.
But
Thanks,
I think if you can fix it and you have time, you should take the time, because it would just make it less of a possible issue in the future.
Definitely will attempt to, but I heard it can take a while, so I was hoping to understand. Thank you.
Thanks, Erica. We have a question from Gabriel. Has anyone managed to consolidate vaccine records from 2 different states?
My guess is if you have a medical provider, you get that medical provider to verify it, and then that medical provider sends it to the state or whoever is recognized as an issuer of a common trust or VCI type SHC. Then it basically would end up looking like one barcode, QR code that shows both. That's my understanding.
So thank you. I see Tariq responding to a question by Bernard on whether the Clear app QR code is accepted.
You gotta take a look at this list. There's a long list of verified issuers.
Mm-hmm. To check that. And
Texas, I believe Texas is not. When I last checked, last night, it was not on the. Yeah, sorry.
So what do folks in Texas need to do then? Or folks that are coming from areas that don't have one of these digital vaccine records? What's the best
health provider may have it, but if they don't, then my best guess is they should get a health provider in their state that will do it, and then get their records ingested into that and get that health provider to do the verification.
David, I know you've been helping a lot of several folks in Texas for this. What are your comments on some of what they should be doing? Any advice?
Hello, Jeff.
Hello.
Yeah. I think in this case, the community has been actively sharing some of the possible providers that can help with regard to this. If you're not already in the Texas chat group, you should. My personal advice is that you should check with your healthcare providers for a start. If your healthcare provider is really unable to get that SHC, that's where you need to ask the community around you to see, because there are others who have gone through the same journey, and some of them already have successfully gotten the SHC via other means. So just find out from them, and yeah, just go and get the SHC to make it work. I mean, worst come to worst, as Mark and Jess mentioned, if there really is a lot of issues getting the SHC and you need to fly back to Singapore, there is also the non-VTL route that you may wish to consider. And it's 7 days now. It's not as bad as before. And if your place it's safe to self-isolate, you can actually do it at home as well. So do consider that as an option. And then when you're back in Singapore, you can take the serology test and update your trace together once and for all. And you don't need to worry about that digital vaccination cert anymore. Yeah. So do think about the option if the SHC is really a colossal problem for you.
Yeah.
Thank you,
so
David.
I have a, like, my personal opinion is that someone could say, why make it so mafan? Why not just take the paper CDC card or wait until the rest of the US, whole of US accepts digital records? And my take is, I'd rather that you start it now when many people can do it because they have a digital record, than wait for all of US to do it, and then you deprive all the people who can do it from actually going on the VTL. So it's a bit sad, obviously, for those of can't, but I think you can fix it in the end. Maybe when you get your booster shot, try and get it from another healthcare provider that is on the list, and then at the same time get them to add all your first and second shots into that list.
Thank you. We have a question from Richard on whether the vaccination from Singapore is accepted in the US. So let me read the actual question. It's I'm sorry. So the screen's being scrolling a bit. Is the paper card from Singapore showing vaccination in Singapore sufficient, I suppose, for entering the United States?
CDC basically kind of said yes, but you can just get a digital copy using Notarize. I wonder if I have found a link from this here. How do I get a digital vaccine record from SG to show to US? Just go here. It looks very official.
Got it. Thank you, Mark. Another question from XY. If I just get a J&J booster, it shows up as SHC first dose. Is that adequate? Interesting.
Yeah, because Singapore says right there that they accept 1 dose for J&J. That's the only vaccine I think that is 1 dose accepted.
I see. Okay, thank you. Oh, Richard's just clarified that it's actually for the flight back to Singapore from Seattle with a paper record. No, I think we want to have a digital record, right? Is that the position that we're hearing from the authorities, Mark?
Say again?
So Richard's asking if a paper record would suffice, and we're suggesting that the authorities are accepting digital vaccine records.
From
Is that
Singapore to...
No, from the US.
US to Singapore?
So yes, US to Singapore. He wasn't clear before. This is for the flight back to Singapore from Seattle.
If you want to go in VTL, it has to be a digital record. Right?
Yep.
If you just want to do that 7-day thing and then still get fully vaccinated trace together, that step can work with a paper card. That was the older path that they started in September. If that matters. Oh. What was the question? wait, I mean, if you just want to get the vaccination, this is from Singapore, talking about Singapore vaccination or US vaccination?
No, it's US vaccination.
I
US.
think Richard is referring to, okay, this is Hui Hui again. Richard is referring to Singapore vaccination, right?
No, he just clarified to say that
Okay.
he just clarified at 8:58 saying the questions for flight back to Singapore from Seattle with a paper
No,
record.
but his paper record is from Singapore or from US?
Singapore.
Ah,
Yeah,
yes, I see.
So with his Singapore paper record, I mean, even if he has fully vaccinated in Singapore, he will be able to get either a digital copy through notarized, and that will suffice for the flight back.
Yes.
Yeah, and
just do that.
Yeah, and MOH paper record is accepted as well from Singapore.
This is the actual CDC website screenshot, so they accept paper records.
Perfect. Man, there's so many permutations, folks, for all this. And I know that in today's session, we probably can't cover all the special permutations, but it seems that, I think you can reach out to Hui Hui from the council if you have any special questions. And of course, refer to some of the links that we have posted here, because as Council General William just mentioned, a lot of these things are fluid and they may change. And even the name situation, as we just saw, right? It's up to the human beings perspective of how much of a name and the birth date is within within the record to be able to qualify and be recognized as you, right? So there are a number of different exceptions as we work through this process, for sure. Seems like. Mark, do you want to keep going on so that we? Yes.
By the way, I just want to add. Some folks were thinking maybe don't need to bring that CDC paper card. You could, or you at least, I think you should always have a screenshot of it, because you can see it is a verifiable means just to get from Singapore to US. Okay, PCR testing. I think it's slightly easier than QR codes. So this is from USA to Singapore. Lots of folks have asked, how do I check that this particular test is approved? And MOH doesn't actually give you a lot of detail for the US. It just says check with the, like Department of Public Health, basically. And there's not much ways you can check in California or any other state, but this is my take, and I think SIA can confirm, the consulate can confirm this as well. It just has to be a PCR test. And the results show your name, date of birth, or passport number. Usually date of birth is what most results will give. Any questions? So the next one that is really a key question that was asked was how long before the flight do I have to take that test swab? And we have gotten a lot of clarification that the 48 hours is now no longer 48 hours precisely or strictly from the departure time of the flight. It's 48 hours from the departure date of the flight. So I just gave this example. You can actually test on the morning 2 days before, even if your flight is in the evening. And it really gives you more than 48 hours actually in those cases. But of course, if you want to play safe, just do the strict, then you will still meet the definition. Now, a question on connections and transits. This is the real rule. I guess it gets tricky if you have booked 2 separate itineraries. Any other? I think we kind of heard the gist of it, though. The sooner you can take the test before the flight, the easier you just make it count.
It's a great point. We're seeing some chat here confirming that SIA staff are not medical experts. I think that's the case for all airlines as well. So they will accept the records, right, issued by either governments or health authorities, but they will have to they have to rely on that.
My personal take is you're still going to get a test in Singapore. So in Singapore, of course, manages that test, approves it. So this pre-departure test, I think Singapore is giving you a little slack, but obviously don't overdo the slack.
Mm-hmm.
Can I use insurance to pay for the test? I don't really know what the answer is. Some people have gotten away with it, and some people check and they say that actually you can or cannot. Also to note, most of these rapid tests, meaning those that are really fast, like less than 4 hours or even 1 hour, and they're usually the ones you get at airports or next to an airport, they usually do not qualify for health insurance. However, I believe, and you can check with IRS, you can still use HFSA funds to reimburse them fully. So what about using a free test? Many people say they have tried it. And I think these tests are technically or supposedly not meant for travel-related purposes. They're meant for if you were suspected of COVID, symptoms, or you're in close contact with a COVID patient. Some have gotten away from it, and the main challenge is just dealing with the 48 hours, given the caveat about date and time before the flight. And for the list of places, now we tried to do a little survey. I have not seen many results, probably because it's not as exciting a topic, but there's some results here. So.
And just as a pause for a moment here, CC is giving a little bit more color in terms of the elements of the test certificate, right? In the chat window, folks, so you guys can refer to the details there as well. It has to be in English and so forth. So do take a look at that as you consider, right, the test certificate that you're getting.
Yeah, also I guess it's good to add test date. Yeah, we can update this.
Yes, and this is referring to the PCR test before the flight from US to Singapore. Thank you, CC.
Thank you. So yeah, you can still share your experiences, and this is all easily, publicly viewable. So we'll see how useful it is. All right, self-isolation. It was going to answer one question. So let's quickly go through. You can't self-isolate Changi Airport. They want you to get out. Hotels. Can you do early check-ins? You need to figure this out with the hotel, and hopefully you don't have a messy situation. So if you have to check in early, you probably need to book a night before, or you can convince the hotel to maybe give a reduced rate if you check in on the morning of your arrival. So just make sure you got that covered. This is a non-exhaustive list of hotels. It just happens to be out there, but if a lot of contacts, you can call and check. We've heard about the timing. Officially, ICA's website says up to 24 hours. You heard folks said maybe 2 or 6 or 4 hours. So you decide, but plan for 24 hours. And I believe this is correct. You can also stay at a home if you can stay isolated in a room that has an attached bathroom or toilet.
Great, thank you, Lynette. I hope that answers some of your question. Do you have more questions after hearing this? Yes, that answers it. Perfect, thank you. T. Chu adds that we need to check if toilets are equipped to take travelers during isolation. So not all of them, is that correct? There's a list of
hotels, not toilets, right?
Yes, hotels are equipped.
The toilets are equipped to take.
That's true.
Wow, this is quite tricky.
Hotels, yes. Checking to see if we're still awake, but yes, hotels. Now it says here, if you have status, Tariq, thank you for that tip and question. If you have status with some hotel brands, for example, Marriott, can you request for late request for late checkout without paying more? So that sounds like a great tip. I agree.
More travel tips, yeah.
Yeah.
How did you maintain your status, by the way, during this pandemic? Never mind. Okay, key things. Make sure that you don't take public transit. Just go straight to the hotel, and if your friends or family were to pick you up, there's a lot of details on the disinfection process and all the key things, because they want you not to transmit a case to Singapore. And I would like to hear from those who were notified. How did you get notified if those who've experienced it? I understand that clearly the apps will be notifying you. I don't know if you also get an SMS or an email. SMS.
Hi. Yeah, I got an SMS and also an email.
So it's really all of the above.
I want to put it out there real. Sorry.
Yeah, thank you. So it's all of the above, if it's all set up correctly.
I want to just chime in real quick about if the sort of results will come from Raffles Medical, and you'll get an email that clearly states all of that, but none of the agencies would actually receive the information about you. So your hotel is not going to know that you're free to leave self-isolation, and they'll freak out if you start walking around without telling them first. The other thing is that I've also gotten calls from ICA themselves asking whether I'm still in self-isolation, which is really odd. Even though, my health hub had already been updated. So and then the hotel also called me a couple more times to verify again that I've gotten the results, and actually had to go forward then the result to tell them, yes, I'm free to leave self-isolation. Please change my key card so I can get out of my own room. But yeah, once you get your own results, I would greatly suggest informing whoever needs to know about the test being cleared.
Dale, Oh, sorry, go ahead, Mark.
Even on SHN, the hotels don't let you out at 12 p.m. They actually want it as a last check to see your phone showing the SMS that you were also cleared. So.
Right. And Dale, could you just kind of
Mm-hmm.
walk us through your journey? So when did you leave San Francisco? How did you do the whole testing? Which day are you at now? Are you past your self-isolation period and all that?
I'm way past, yes.
Great.
So I flew on Sunday night, like this past Sunday, and then I arrived on Monday. Wait, sorry, I flew on Saturday night, and then I arrived on Monday morning Singapore time. That's about 6 a.m. That's SQ33. I did the tests at the airport like literally on arrival. That's like within half an hour of arrival. They basically ushered you right through. Took the cab. Apparently, any cab can pick you up. Took the cab to the hotel. Was issued a card, ushered into a separate lane, like so I stayed away from all the other entrances, and then just basically hung around the hotel room and took a nap until my phone went off. And I had at that same time, that was about 4 hours in, and then I had an email, and then after I got the email, I went on just because I figured that the hotel didn't actually know what was going on. I actually forwarded on to them, didn't hear back, called the front desk, and again, told them, hey, I'm done, and then they're like, okay, you can go. And then after about a couple of hours, someone from the front desk called me and said like, hey, we noticed you've left the room. Have you cleared your test? So they don't really talk to each other. But I would say that I would encourage you to see that the vaccination status has already been updated on the Trace Together app. Once that is in, it forms a sort of a source of truth. And then once you walk around, people are not going to question you anymore. But and oddly enough, after that, like about 2 p.m. in the afternoon, ICA calls me and goes like, "Hey, hi, we are not, as they just going to call me to inform me that I should be staying in self-isolation until my PCR test is clear." So it was quite messy, at least from a communication perspective. But yeah, I was done with self-isolation about 4+ hours in after I arrived. Yeah.
Got it.
You have
Looks
a very
like
smooth experience, Dale.
Thank you. So I have a small question. Does this whole thing include food? I mean, like, do they deliver food while you're in the hotel room? Is it like the SHN experience where you're paying for everything, including food, or is it different?
So self-isolation, just to roll it back a little bit, rewind a little bit. When I booked at the hotel, I took my reservation, and then because I made the reservation online, I called the hotel thereafter to tell them that this is specifically for VTL. And what they did was they set up, when I got to the hotel, they set it up in such a way that it was packaged as a staycation.
Which hotel were you at, Dale? Just to contextualize, because it might be.
I was at a Fairmont.
Okay, thank you.
I was at a Fairmont. But so the Fairmont classed it as a staycation, and even though I was still in self-isolation during the initial period, they said, well, you've got breakfast every day. So when I arrived at the hotel, it was time for breakfast. So breakfast was delivered to the door. But I was also told that along with that, because it was like staycation and it was designed for SHN, that meals could be delivered to the door as well from the hotel's restaurants. So all of that was rolled into the price. Yeah, it was just really kind of nice.
That's great. Is it a different price for different hotels? Or is it the same standard price as it was for SHN?
I did it as a private individual, as in like I'm not under any scheme. So basically, the assumption had been like, hey, the baseline would be to take your self-isolation at home. And for me personally, anyway, I did the extra step, because my grandmother is like really, really old, and I don't want to be that person to bring it home. So I took the extra step to hang around a hotel for until the test was cleared.
Basically, you have to pay for it, and it's your personal decision.
That's right. Market's right.
That's very helpful.
Earn points and maintain your hotel status is another question.
Yeah, I wasn't thinking about that, but yes.
That's really helpful. Thank you for walking us through that process. It sounds like some preparation is needed, some communication with the hotel ahead of time is needed because there isn't necessarily a program that is codified. Even then, there's some miscommunication within the hotel about whether you're in or out, right, at the same time. So
Yep.
it looks like there's still a couple kinks in the system, to work through. And so I think we all just have to kind of take it as it comes, it seems, because like Anna, for example, didn't have her record updated in time. You seem to have lucked out, Dale, because you got your trace together stuff really fast, and other folks are saying it's not as quick. So
hey, let's
thanks for
segue.
sharing.
Let's move on.
Yeah.
So what's trace together? Anything else, Dale? Good.
Nope.
Thank you.
So anyone who hasn't followed the news, hopefully you do know that Singapore has this app called Trace Together, and it's pretty much mandatory now. So you need to install it. It's mandatory, and technically everyone above the age of 7 has to use Trace Together. If you're to a young age, you can actually get a Trace Together token rather than installing an app on your mobile phone. So there's this long thing called Vaccinated Differentiated Safe Measurement Measures. It's a really long acronym, VDS-SMM, but basically means that you need to show a vaccination proof to enter all these kinds of locations, and they only take Trace Together to prove. Some people may get away with your MOH cert or maybe overseas cert, but unlikely. So that's why you want to get Trace Together to be updated. You can read all the details here. So what phone number to use? I think what we just clarified is you can't certainly use a foreign or US phone number that has roaming enabled. I just want to know, Dale, do you actually register the Trace Together in the US, or did you only activate it in Singapore? Like, can you actually download and activate it in the US?
Trace Together, I put together the logins when I was still in the US, and I did it via Health Hub, I believe. So I did it here, and it was connected already before I arrived in Singapore.
Yeah, so that's what I'm getting at is I would recommend those who are non-short-term visitors to get the app going before you fly. You can download it right now and go through all the activation, SingPass, whatever in the US. It's only short-term visitors on VTP that are not, like in the SingPass system and all that. Then they have to wait till clearing immigration, then they can activate the app because the name, will be in the system. And I just found this bulletin. If you really don't have a mobile phone that can support Trace Together, you can rent a mobile device, but you can really read the FAQs for more details. I don't think most of us fall into that, but you could check this if you have kids that are over 7. Dale, I don't know if you can answer this or anyone. I was under the understanding that you can buy an SG SIM card in the pre-immigration part of the airport, but certainly once you've exited immigration, you must not visit any other shops. So you may want to figure out how to get your mobile phone roaming working if otherwise.
As for Singapore SIM cards, when I got off the flight, I was ushered straight from the flight to a travelator, and from the travelator straight to immigration. So I did not see the opportunity to get anything, do anything. Everything was pretty much shut down.
Right. The FAQ on ICA site says you can do this, but I just wasn't sure how realistic it is.
This is Anne. I got one when we land for my son. So just before you get into the escalator to the immigration, there's such a counter there. You just ask any of those staff at the gate where to get SIM card. They know exactly where to go.
Okay. So must you use Trace Together? Yes. What phone number can you put? I understand is you can put even a US phone number, right? That's again clear. You don't have to put that new Singapore SIM phone card number. So, okay, the next question is on the serology test. So kind of a little history is basically lets you get your fully vaccinated status to stick past 30 days, and you can see that this is an MOH or ICA or Singapore requirement. They pretty much want to have, I think, more confirmation that you truly have a proper vaccination, meaning an antibody level above some threshold in order to be considered fully vaccinated past 30 days. So you can do it at many places. We're not going to get there because it's quite easy to search, and again, anyone who's done it can maybe advise me the lowest fee is about what I see here. So, and also, how fast does it take? Is that any anecdotes we have? So far, maybe any details? Okay, if not, we'll move on.
It took about 2 days, so
Yeah,
if that's anything. Yeah.
And bear in mind, I don't know, this is a very corner case. If for some reason you don't want to pay $60 or whatever to do the serology test, and you just want to take the free vaccination at Singapore Office of Citizens and PRs, bear in mind that it will take more than 30 days for you to become considered fully vaccinated in the Singapore system because of the interval between the first and second jabs, because Singapore doesn't do like, J&J, for example. So probably you want to do a serology test, but just in case you were thinking about this.
Hey, great. On a tactical level, right? Some of us are concerned about Trace Together app and being able to activate it without a SingPass. Is that something that's possible? If we don't have a SingPass or a SingPass does not work, can we still do a Trace Together app and install it?
I can't remember. Because clearly the VTPs don't have sync passes.
Right.
I was under the impression that there was actually a Trace Together token that we could use in lieu of the mobile app. Is that still available?
Yes, but I think you have to qualify for it if you are a visitor. If you're a Singaporean, you can just walk into any CC and get it.
So June, I think we need to look into that. I'm concerned as well because I don't have a SingPass or a functional one. Because I think the one that I had when I first registered SingPass was this old mobile phone from maybe 20 years ago. So I think that I'm probably trying to get SMS messages from there every time I try to revive my code and it's not working.
The SingPass, yeah, it's a separate topic. You just have to download this app and it does a facial recognition and it recognizes you. You don't need to receive like a PIN number or anything. But this is
what do you mean by how is it recognizing me? Does it from my cross-ref against my NRIC? I mean, what do you mean by recognizing me?
I think every time you leave Singapore, they take a picture of you. So I think they have so many pictures of you that they just build up a facial record of you.
That's really cool. Oh, by the way, Saraf just kind of helped clarify that he just signed up for a Trace Together without SingPass. So that's awesome. And CC is also confirming we don't need a SingPass, just need an IC number and date of issue. Thank you, Saraf. That is reassuring.
Okay. There you go.
Okay, one question. Private transportation, that's a good one as we're looking at the whole customer journey, right? From flying in the airplane and then doing all this whole process. There is a Jiyong is asking about transportation. So
yes, that it's right here. It's on this.
Oh, family, perfect. Thank you.
And note that really, I don't know how they were enforcing this, but you're supposed to be very cautious about it. So I guess no hugging. Only one family member can pick you up, not like, two people come and pick you up. By cool, you mean creepy? Never mind. Okay.
I'm still trying to figure out this whole pickup thing. I see. That's good to know. Thank you.
Any other questions? We go on to, I'm almost done. Miscellaneous was the last section.
Yes, that's actually a great job here. We have 7 more minutes for today's session. So folks, if you haven't asked your question, please post them in the chat window. Otherwise, you can reach out to Hui Hui, of course. Thank you, Hui Hui, for being our, information source. And of course, folks, do refer to the links that we provided here so that she's not overwhelmed, right, by some of the basic questions that are already here. So appreciate you guys taking a look at the deck and then also reaching out to her if you need to. Because you can imagine she's getting every message from everybody who wants to go home to Singapore.
Yeah.
Thanks.
Yes.
All right, Mark, take us forward.
Okay, so as someone mentioned, this arrival card, yes, it's really before you arrive in Singapore, and due to all these funky time zone things, in practice, you probably can only fill it up literally just before your flight. So don't panic if the site blocks you. Don't be that ganchang. Just do it before your flight. Do print it out though. It's not essential. It's just a good idea because when you want to present it, you don't need to have all these folks, touching your mobile phone, contactless, right? But so for ironically, although it's on paper, you are better off printing it out. That's recommendation, and just good practice. And so yeah, it was that. I think some of these questions were repeated, so I kind of pasted them in the other sections. So yeah, I actually done and into Q&A, and I just want to have you a great bonus. Almost all the questions you asked individually are they've actually been answered. Even if we had to give a short answer, we got them answered. I guess I just have to find where I put it. But you get the idea. There's a link over there, and we actually, yes, I think I found it. You can go to this link, and I just want to just thank all my fellow speakers who actually helped answer all the questions that people put in within certain, reasonable degree. So you can go to the link. So now we are truly open to general Q&A. There's still any left? Can we amend the mobile number on TT app from US to Singapore when we land in Singapore? I think the answer is yes. You just have to reactivate it.
Okay, we have a few other questions. Blitzkrieg coming in, Charis. So for category 2 countries, which is the US, we can isolate ourselves in a room that is with other family members who aren't on the same travel itinerary. Is that correct? Can we confirm that she can isolate herself in a room with other family members who aren't in the same travel itinerary? Or do they need to be the same itinerary as well? Oh, David, thank you. There is a link that David is responding with. Perfect.
Yeah, David answered that.
Moving on, there's a question on SQ. Will SQ have economy VTL flights from SFO? And will UA have nonstop? We don't know about UA, but maybe maybe we can find out more about SQ. And so let's wait for that response to come through. And there's another question on non-Singaporean citizens, right? They don't have the NRIC, so they can't get the Trace Together. They can't get the SingPass. Can they still get Trace Together as an app? And if they don't have that, how do they navigate around Singapore restaurants, hawker centers, and all that?
They have to apply for a VTP.
Okay.
And then when you arrive at immigration, they process your VTP and then they add you to Trace Together. That's why you have to take 2 to 3 minutes after immigration and then go and activate it.
All right.
Also, for short-term visitors, if they're unable, once after they have the VTP and everything, at ICA, I believe that if you're unable to get the app, there will be tokens, the Trace Together tokens as well. It's in one of the FAQ on ICA's website, for non-citizens. Yeah.
Oh, and you probably have to pay $50 or something as a deposit, something like that. That's what I saw.
Okay. Good to know.
And return it before when you leave.
Got it.
That's why on ICA's site it says before leaving, return that Trace Together token if obtained.
Okay, sorry for being super swaku, but is this Trace Together just part of the phone, or is this like some band you wear or whatever it is?
It looks like a floss, a dental floss pack.
That is what? That you carry around as a separate thing.
They give it to you on a neck sling, so you want, put it in your handbag or your sling it around your neck, and it's got a QR code like thing on it, so you can hold it up and scan, or it's got a Bluetooth thing in it, so you can also scan it at all the same readers that would have worked with the phone.
Got it. So David's saying it's like a dongle. So I suppose it's like things that people enter apartments with, or like.
It's a bit bigger than that, but it looks like a dental floss sized pack.
Got it. Okay. Super. That's good to know. I know we assume that everyone knows that, but not everybody actually knows that. It's not an app. It's actually a device.
Yeah. So by the way, I think someone asked, will UA have non-stop flights to Singapore and VTL? I think one thing you may have noticed from a minister who mentioned there are only 4,000 people allowed into Singapore per day on VTL across all 11 countries. This is a number set by Singapore. So I did some math. I looked at the number of SIA flights that are operating and all that. I think if you assume they're all fully filled, it's you probably use most of that quota. So if other airlines want to operate flights, I think Singapore first would have to increase that VTL quota, assuming that things were already filled up. But that's Singapore's decision.
All right, folks, we're approaching the end of our time. I do see a couple of questions coming through here. Maybe we can stay on to answer some of these questions. But in the meanwhile, I do want to maybe, try to wrap this up and see if, a couple of our key officials here have parting words of advice for us. So maybe let's begin with David, whom we didn't get the chance to hear from when we first opened today. David, would you like to kind of share some thoughts about some tidbits or nuggets of this whole process?
Hey, hello, thanks Jess, thanks Mark for doing this. Yeah, so for those people who tune in late, just to echo that SingaporeConnect is a volunteer-run organization. So super grateful to Mark and Jess for doing this for the community. One thing I must emphasize again is that please always check the ICA website for the latest information, because the situation is very dynamic. You don't know what will happen tomorrow. Next week, we know that, it's highly likely that CDC will approve the vaccine for children, and then Singapore will start studying as well. So there'll be new measures that will roll out along the way. So don't treat this as the definitive source to refer to. Yeah, so my suggestion is really go to the ICA website. So let me send you the link. I believe ICA has been taking steps to make the website as user-friendly as possible, including having a very exhaustive list of FAQs that you can refer to. But if there are, echoing what Jess and Mark mentioned as well, if there are any emergencies whereby, you need to fly back to Singapore urgently and really not sure how to, please reach out to Huawei for help. Yeah.
Perfect.
That's it for me.
So much.
Thank
Thanks
you.
so much, David. I know you have been actively fielding all these questions as well across all the WhatsApp groups across the United States. So thank you for keeping your pulse and helping us on this whole situation and helping us sort of stay up to date. Maybe we need to have another one of these sessions in another couple of weeks, right? Mark is like, there was so much prep that went into this, including the whole timeline and all that. So thank you all for doing that. Now thank you, David. Let's move on to Hui Hui. We've given out her email address to some of you here, and we're going to post it again as well over here. But before you guys all kind of like swamp her, maybe Hui Hui, you can give us some thoughts of advice on how you think we should be managing this process.
Okay, thanks, Jasmine. I think the most important thing is that the source that we should all refer to is ICA's website, and ICA actually has like a checklist, be it for VTL or like, if you are a non-VTL traveler, what needs to be done can actually be, referred to on their website. If you fill in the relevant options, like, you're a PR, you're a SC, or, you're traveling from US and stuff like that. So even before you make your travel plans and everything, just make sure to refer to the ICA's website to see if, like, you would actually qualify for the VTL lanes or not. And thereafter, to follow what has been, mentioned in the checklist, you can just tick it off. So it's really easy to follow that checklist rather than like, calling us or anything like that, because that will be the most updated source, and we all have to take reference from ICA's website. Yeah.
Makes a lot of sense. Thank you very much. All right, I think we have covered the key sources. Mark, before we close off, any thoughts?
Well, thank you everyone who sent us these appreciative messages in the chat. It's been personally a lot of hours of work responding to many of the messages. Even as Hui can remember, vision, and also many hours of work just drawing all the diagrams. So hopefully this was of help to some of you, makes the process a little smoother. Hope you avoided any hiccups that may have happened thanks to the tips on this forum. So just want to say an overall theme. SingaporeConnect exists because of the passion of volunteers, and so do join us, or do join our events. Join our mailing list, Facebook group, Facebook page, whatever. Subscribe to our YouTube channel, and just stay safe and keep active in our community. It's happier, right? Despite all these times when we can share and stay connected.
Right, and join us for Deepavali as well if you guys want to, take part in some of our ongoing
online to the dance challenge, obviously.
That's right. Okay, well, everyone, thank you, and especially thanks to those of you who joined us from Singapore to share your experiences, right? Because it's always great to hear from those of you who sort of, the pioneers, right, who are working through the kinks in this journey. Dale, Anna, Kelvin, thank you for joining us this evening as well. All right, everyone. I think this about wraps up. I would advise you guys save the chat window, save the chat in your Zoom session, because we have a number of links there, such as links to the deck, right, that everyone's been asking for as well, and contact information for some
and
of
then
the.
we will post the updated slide set to our SingaporeConnect website. So just contact SingaporeConnect@gmail.com if you can't find it.
That's right. Well, everyone, thank you very much. Stay safe and happy travels for those of you who are going to be heading over to Singapore soon. Take care. Bye for now. We're going to keep the chat window open for a bit more in case anyone has questions. And posting as well the link to the deck one more time, so you can click on it. Many thanks to all of you who have also been helping to respond to some of the questions in the chat window, especially our travel experts. I'm going to post as well, June, Hui Hui's email address so you can reach out to her. Remember, the first point of information resource should be the ICA website, because that continues to change. And so you'll get the latest information there. But if you have a particular question related to your personal situation that you don't see a permutation for, do indeed, reach out to her, because our counselor team is super supportive and definitely wanting to support you in your efforts to return home.
Yeah, and obviously, please appreciate that if you email me, I have many other personal things, family things to do. I will not necessarily message or reply to you promptly. Similarly, Hui, although she's, and David, although they are full-time, but they get a lot of queries. So just understand that. So as David said, please, I put a lot of the links to everything that information was sourced from. So take your time and effort to read everything so that you don't ask the question that, hopefully could have been answered from this presentation or from the links. But everyone, safe travels.
Yeah, and thank you once again to the Ministry of Foreign Affairs for joining us this evening, the Singapore Global Network for joining us this evening, as well as some of our travel experts and our recently traveled folks, for all your feedback and
enjoy
help.
all the yummy makan in Singapore, all those
That's
in
right.
Singapore.
Take care. Bye for now, everyone.
Good night. I'm gonna sign off. Bye-bye.
Bye. Thank you, Adrian. Good night. Thanks for
Good night.
joining us.
Signing off.